Well, great, and welcome everybody. Good morning or good afternoon, depending on where you are. It's 11:40 here on the West Coast in Seattle. It's a pleasure to join all of you this morning. Let me share my screen here. And let's get started. So, why is that slide not advancing? There we go. So yeah, let's do a quick introduction. So my name is Matt Claps. I'm the Senior Director of Practice for Child and Family Services here in KC Family Program. So I'm part of the senior leadership team. And my colleague joining us today, Amy.
Hi, I'm Dr. Amy Zimmermann, and I'm the Director of Systems, Data, and Reporting in Child and Family Services at KC.
Great. And as I'm sure has been said many times in many workshops, just want to give our disclosures that neither Amy or I have any spouse or significant other or have had any relevant financial relationships during the past 12 months with the University of Kentucky. So just want to share that disclosure. So what we plan on covering today, as I'm sure you could surmise from the title of our workshop, we really want to tell our story about how we've been using our CANS data and our electronic health record data to improve practice and improve outcomes for the youth and families that we serve here in Child and Family Services, and how we've been using predictive analytics, or what we call precision analytics, to do some of that work. So workshop's going to include both how we went about developing some of our precision analytic tools and some of our experiences in terms of rolling them out, what we've learned along the way. And we're going to demo a few of those tools as well as we work our way through the workshop. Please ask questions at any time. Amy and I are going to be monitoring the chat. I'm going to start out just by sharing a little bit of background and history around KC Family Programs and the work that we do. And then highlight two of our tools that we use from Word of Program Management. And then I'm going to turn it over to Amy, and she's going to go into a whole lot more detail about how we went about building what we call our social worker dashboard, or an individual client-specific case planning tool that we use, where we've been incorporating some of our precision analytic work. But please throw questions in the chat along the way. We're also going to hold time at the end for any Q&A as well. And with that, I just want to do a quick sound check, make sure I'm coming through all right. I've been having some filtering, internet connectivity issues. Thanks for the thumbs up, y'all. So let's get started. So let me just tell you a little bit about KC Family Programs and the work that we do. And I'm going to share this just to offer some context. Some of you may have worked with KC in the past, but I think it's important that we always start by recognizing Mr. Jim Casey, who was the visionary leader who founded United Parcel Service. And, it was in his experience when he was starting the company as the oldest of his siblings as a young teen in the 1920s here in Seattle, when it was a bike messenger service that grew over the years to become the global juggernaut of United Parcel Service. And one of Mr. Casey's early experiences was that some of his most dedicated employees were those who had support and connection. And so, in the 1920s, they may have been called orphaned youth, but he found that when he could provide those persons with support and with connection and with stable employment, they became some of his most gainful and productive employees. And it was in those life lessons that he recognized the importance of permanent connections and permanent connections and support. And so that is really embedded in the DNA of our organization, of KC as a foundation. And so we were formed in Seattle in 1966, and we do work in all 50 states. And part of our work is our direct service work. where we operate field offices in 10 communities, largely in the western third of the country, where we provide out-of-home services and in-home services and services for young adults. We also work in all 50 states in a consulting capacity, where we work with state or county government, or also tribal nations, providing technical assistance and consulting. And we also work in Washington, D.C., where we do public policy work, all under the umbrella of our foundation's mission, which is to provide and improve and ultimately prevent the need for foster care in America. And so as you can see from the map here, you can see the locations where our offices are located. Again, offices in Washington and in Idaho and in California and in Arizona and in Texas, where we do our direct service work. And we run our Indian child welfare programs out of Denver, Colorado. And then we have various offices where some of our consulting teams are based, like in DC or Atlanta or New York or in Sacramento, just as examples. But for what we're going to be focusing on today, our story is about some of our direct service work. And so as I was mentioning, when we were founded as a foundation here in Seattle 55 years ago, we were originally founded as an agency that provided long-term foster care. And that ties directly back to Mr. Casey's experience around permanent and connected and supporting relationships that he gained those life lessons through both his work within United Parcel Service, but also as the oldest of all of his siblings and caring for his siblings when their father died at a very young age. And so he dedicated his family legacy to building and supporting our foundation, where we originally started work providing foster care services. Over time, our service array and our practices evolved to where we also provide in-home prevention services or post-permanency support. We also provide services for young adults who are enrolled in our program. And then lastly, we have a scholarship program as well for youth who are in our care. So just to give you a sense of our size and scope, on any given day, we're working with roughly 800 to 1,000 youth and families across all of those programs. The majority of our work is in our out-of-home care program. Roughly 70% of our caseload, so about 700 youth. The remaining 30% is evenly split between our in-home and our young adult program. So I'm just sharing that with you just to give you a little bit of background and history about the work that we do. Our presentation is going to focus specifically on youth who are in our out-of-home care program. But the last thing that I want to share in terms of context is just to tell you a little bit about how we do our work. And so this is our practice model. I know a practice model is a term of art. I'm sure many of you have your own practice models in your agencies and organizations. And to orient you to our practice model, it really is grounded in the simple logic that good practice leads to good outcomes, and both require good organizational support. So first and foremost, our work is about how we can achieve outcomes for all of our youth and families so that they are safe and that they feel safe, and that they are legally connected and feel connected to family and community and their culture, so what we'll call legal and relational permanency, and that their well-being is enhanced and that they can thrive, and that that's evident in the health and the relationships that they have in school and work. And we believe that this work gets done by way of our values and our approach and our processes that we use in our practice. And just to name a few, some of our core values is that our work is family-centered and relationship-based. We approach the work with a sense of cultural humility and recognize the importance of empowering relationships with all the youth and families that we serve. We do this work with an urgent, relentless approach, largely through child and family teaming models, where we try to incorporate a trauma and healing informed care perspective. And that all of our work is individualized with our youth and families. And what we believe is that every youth and family is a unique and individual test of our ability to meet their unique needs. Part of our practice includes accurate and ongoing assessments, and that's where the CANs and the FAST come into this part of the work. So we've been implementing the CANs. We started our implementation in 2013 where we incorporated our CANs into our electronic case management system. And because of that, it's given us a really rich universe of data that we're allowed to use for some of our analytical purposes, which will be the rest of the focus of this presentation. We also use the FAST as well. We use the FAST in our in-home program, and we started using the FAST in 2015. So we're about 8 to 9 years in our CANs implementation journey. And so with that, I want to share a little bit about some of the work that we've been doing, incorporating precision analytics into our work. And so for us, precision analytics is really, it's an umbrella term. And what we're talking about is how we use past data to make recommendations about what strategies or interventions will increase the likelihood or the chance of positive outcomes for our youth and families. And for us, the core outcome that we've been focusing on in terms of modeling our data is around the achievement of legal permanency. And we use the term precision analytics intentionally. And I want to give a shout out to Stephen Shimshock, who I saw on the screen earlier, and also a partner, Pete York, who's been our consultant all along through this journey in terms of helping lay the foundation and supporting us through our implementation. But the term precision analytics is actually adapted from healthcare and precision medicine, which kind of at its core is just asking the question of how do we get the right treatment or intervention to the right client at the right time. And for us in Casey, and this is just part of the culture that we're trying to create, we were really intentional in using the term precision analytics as opposed to predictive analytics. And we were using the term precision analytics because from our point of view, what we're trying to do is support our staff and support our child and family teams to make the best decisions that they can at the time that they have to make those decisions, or making more precise decisions around their practice and their service delivery. So a couple of the ways that we've been using our data in terms of trying to bring information into the hands of our practitioners has been from a program level perspective and a social worker or individual client level perspective. So I'm going to share a little bit of information about our program level data and how we use that data in terms of our overall system administration and management. And to tell you how we got here, we started this work with BCT in 2015, and this was under Stephen's leadership when he was previously on our team here at Casey Family Programs. And then Amy has since stepped into that role a little over 3 years ago, where she's carried that work and continued to advance it into where we are today, which I think is some pretty groundbreaking and innovative tools around how we're using our data to better inform decision making. But what we harnessing the power, the computational power of machine learning, we were able to identify various clusters of youth that we're serving within our out-of-home care program and how the characteristics of those youth are correlating with the outcome of achieving legal permanency. And then working again with Pete as one of our consultants, we're able to build some real-time data reportings so we can track our progress over time. So I'm going to share with you a couple of these reports. So we know that the overall exit to permanency rate for youth in our out-of-home care program is 65%. But within that 65%, we have variability in terms of the characteristics or patterns of youth and families and their own unique experiences and how they're exiting successfully to legal permanency. So what you see here is a breakdown of our current machine learning informed precision analytic model that shows 9 different clusters of youth. And not surprisingly, like when you look over on the far left-hand side where you see a 41% exit to permanency rate, well, these are youth who were clustered into generally older with identified risks from the CANs, so from the risk domain. And their exit to permanency rate was 41%. If you go to the other far side of this breakdown, you'll see that youth who were less than 15 years of age, but when they were removed and entered into foster care, but their foster care placements were actually court-ordered, non-licensed placements residing with family, that their exit to legal permanency rate was 90%. And then you can see all the way through these different clusters the various permanency rates for those groups of youth. So I circled a couple areas here. On the left-hand side, you'll see the 41 or 49% youth 15 to 17 years of age who didn't have any identified behavior or emotional needs or risk needs from the CANs, or 66% right there in the middle, a permanency rate of 11 to 17-year-olds who'd had 3 previous placements. Well, the kind of interventions that you're going to be thinking about in terms of your programming are going to look a whole lot different than, say, moving over to the second circle of the 81 and the 87% rate, which is about youth who are either already residing with family or are more safe and stable with less mental health or risk needs, but maybe what's necessary in our practice is more family finding and family engagement. Well, your intervention strategy selection is going to look different in terms of how you approach your service delivery. So I just call these out as a way of like getting one layer underneath what our overall outcomes are. And then from a manager, from my perspective, thinking about, well, if I'm on the left-hand side, how are we supporting our staff and their skill building around supporting families with things like behavior de-escalation or crisis intervention? Or moving over to the right-hand side of this, how are we supporting our staff in terms of their skill building as it relates to family finding and engagement, case mining, those kinds of practice strategies? And then this report, what we call our data trends report, this is just at a snapshot, is giving us some insight into what does our current caseload distribution look like across all of our programs. And so on the left-hand side, you'll see the various clusters. This is actually a previous model. This is our data from 2015 to 2017. But just to break this down, at the very top of this, you'll see youth who were 0 to 6 years of age, who were placed with family at the time that they entered into our care. Well, not surprisingly, 97% of those youth, they exited to legal permanency. But if you go to the very bottom of the graph, you'll see youth who were 13 to 17 years of age with 3 or more placements and who had identified needs or CAN scores of either 2 or 3 on the life functioning domain. Their exit to permanency rate was 34%. And again, you can think about the different kinds of interventions you might want to be using with your clients as you're looking across these various clusters. But what this graph is telling us is a real-time snapshot of what our caseload distribution looks like. So at the very top in that light green bar, that's 7% of our active caseload. Moving down to the bottom in the red bar, that's 8% of our active caseload. And you can see that the largest proportion of our active caseload are these 0 to 12-year-olds who weren't with family at the time that they were referred to us, or 0 to 12-year-olds with either a 2 or 3 on their adjustment to trauma item in their CANs. And the dotted line in the middle is telling us what the caseload distribution was at the time that we built the model as compared to where it is now. So right now, and for the 0 to 12-year-old range, that's roughly 39% of our caseload. That's a little bit under half of all of the youth that we're serving, and that's been growing over time. As opposed to down at the bottom of the graph, there's 13 to 17-year-olds, which actually historically has been part of our target population. The distribution or the number of youth that we've been serving that fit those categories has actually been decreasing over time. So again, as a program manager, as we see the shifts in our caseload distribution, it just helps inform us in terms of how we want to allocate our resources and how we're prioritizing different practice initiatives or improvement initiatives within our programs. And then another graph that we have that I don't have shared here is a real-time reporting around how we are currently performing as it relates to what our predicted outcome levels would be. And so here we're talking about like, how can we beat the odds? And so at the bottom where you would see historically, the model would predict that 34% of our youth in this category would exit successfully from our program. We can do real-time reporting of are we above that 34% or are we below that 34%? And that again, as a manager, can just help us think about how we want to utilize our resources in terms of our programming and intervention. So this is a real quick snapshot in terms of some of the data and reporting tools on how we've been using our precision analytic models from a management perspective. And with that, I'm going to turn it over to Amy, and we're going to highlight how we've been using some of our tools for individual youth and family specific decision making. So Amy, I'm going to turn it over to you.
Thanks, Matt. If you can go to the next slide for me, thanks. Okay, so I'm going to talk about really item number 4 on this slide. So Matt already talked about the first 3, essentially, where we started out working with BCT partners, and then we built this machine learning model. And then from there, that model identifies each cluster of youth, and also the CANS domains and the services that we provide that most frequently coincide with legal permanency. And then for our current youth, we identify what cluster our current youth fall into. And through this dashboard that I'm going to talk about, we provide service recommendations to our workers. So go ahead and go to the next slide for me. So this is a snapshot of the front page of our dashboard. And if you see in the upper right-hand corner, it says click here for details. And so when workers click in that button, they end up with a much fuller dashboard that has a lot more information. And I'll talk about the pros and cons about that later. But this page was meant to be a quick snapshot for workers. And this is coming from our training data set, which we use the Muppets as the names for our training data set. So we have Kermit the Frog here. And so this dashboard and recommendations are specific to Kermit the Frog. And so on the top box, you'll see this has a list of our service categories. And I'll talk about how we came up with those a little later on, but we have our list of services. And then to the left, we have those service correlations to legal permanency. So we see here that family engagement services and family finding services have a high correlation to legal permanency for similar youth to Kermit the Frog. So we're saying, okay, so Kermit the Frog is a lot like this other cluster of youth who have exited to legal permanency in the past. And so for them, family engagement and family finding had a high correlation to legal permanency. And then below that, you can see that caregiver, case consultation, education, and mental health services, those all had a medium correlation to legal permanency for similar youth to Kermit the Frog in the past. And then to the right, you'll see the green star, the gray circles, and the orange circle. And those are our recommendations to staff. So what we're doing in the background is we're looking at how much of these services are the staff providing right now for Kermit the Frog, and should we keep doing the same amount, do more, or do less? And so the green star is saying, if you read the legend, says ideal, maintain this level of service. So this means that this worker is providing the right amount of family finding services for Kermit the Frog that is similar to youth in the past who exited to legal permanency. Whereas the gray circle, it says, if appropriate, focus services elsewhere, meaning that right now this worker is providing even more services than other similar youth who exited to legal permanency. So they might be going above and beyond what's needed. Whereas in education services, right now, it says, the legend says, increase services here to reach ideal level. So this worker is providing a lower amount of services in education for Kermit the Frog than similar youth who exited to legal permanency. So this kind of right at the right point, too much, too little, is meant to help workers kind of balance where they're focusing their efforts to what we've seen work in the past for similar youth. And so if you go down to the bottom section where it says the CANS domains, we see that the behavior, emotional, life functioning, and strengths domains, those all three have a medium correlation to legal permanency for Kermit the Frog. And then we again see the green star and gray circle and orange circle. And the green star in this case for the CANS domains means that you've met the same number of needs or a similar enough number of needs to similar youth in the past who exited to legal permanency. And then the orange circle means, well, there's still more needs here that need to be addressed for Kermit. And the gray circle here means there haven't been a need in this domain for Kermit, and there currently isn't a need in this domain for Kermit, but continue keeping an eye on it just in case. So that's the brief overview of just actually a small portion of our dashboard. So go ahead and go to the next slide for me. Yeah, thanks. Okay. So we built this in collaboration with our Precision Analytics Steering Committee. So that involved 6 social workers, 2 supervisors, 2 directors, 1 CQI advisor, 1 practice advisor, and 1 senior director. So you can see that there were a lot of people from all levels of child and family services who were involved in this co-creation. Go ahead and go to the next slide for me. And so we met about 1 hour a month for over a year. So this is not a small undertaking. It took quite a bit of collaboration. And I call out here that it was collaboration and not just feedback. And so we didn't just come with kind of already baked ideas and say, do you like it or don't you? But we really worked together to build and develop the model and the dashboard. So the steering committee was instrumental in making changes to the way that the services were categorized in the machine learning model to better reflect how they were used in the field. And so just from the outset, we had the workers really helping to shape how the model was developed, which I think is really critical. And then we also iterated on the visual layout of the dashboard, and we had brainstorming sessions and design sessions. And so again, from the ground up, many folks were involved, and specifically direct service workers were involved. Let's go ahead and go to the next slide for me. So the rollout. So I have I'm going to go through kind of our lessons learned here with the rollout and what the take up has been. So go ahead and go to the next one. So these 2 slides come from the rollout presentation. And on the left-hand side, we started out with, what is this dashboard trying to answer? What are the questions that we're getting at here in this dashboard? So it says, have you ever found yourself wondering, out of all the things I could do, what would be most effective for this youth? Or I don't know much about this youth yet, where's the best place to start? So we really wanted to ground in what are we trying to answer here? And then on the right-hand slide, I show you the agenda that we had for this rollout presentation. And it was really just to generate curiosity and invite folks to the users group. And then it started out with explaining what precision analytics is, kind of what Matt went over a little earlier. And then we went into a case example and a dashboard demo and next steps. And I put this here as part of the lessons learned that I'll talk about in a little bit. So go ahead and go to the next one. Dashboard adoption. Okay, and the next slide, please. So this is our graph of how many people are currently using the dashboard. And so you'll see we had the highest number of 24 individuals at the all staff demo, of which there were probably 120 folks who attended, just to give you a sense of how many people actually clicked into the dashboard on that day. And then you'll see it drop down to 1 or 2 and then 4. And then we had a couple other additional lunch and learn sessions for folks who wanted to know a little bit more. And on those we had, 5 people join, and then we had some couple individuals in between, and then 7 people join. But the overall message here is that the adoption and the take up has not been overwhelming by any means. And however, we did get people to join our users group, and that has been instrumental in helping us understand what the barriers are and how we can move forward. So go ahead and go to the next slide for me. So what we've been hearing from our users group is that folks are really interested, and every time we talk about it, they get very excited, but a barrier is just that it's not part of their daily workflow yet. And so they just forget to take a look at it. And part of that is where it's where the link is to it in our electronic case management system. It's a little bit hidden, and so it's just not really front and center for folks. And then a couple other pieces is that the services and even down to the CANS domains as well, it's just not detailed enough. So they're saying things like, this really isn't telling me anything new. I mean, I know that this youth needs family finding services. What else is there? What more detail can you give me? And then also they're saying that the dashboard has just so much information on one page that it's overwhelming, and they're not getting just that quick snapshot of information that they would like. So those are some additional barriers that if they do go into it, they're just kind of overwhelmed and then don't choose to go back. So go ahead and go to the next slide. So from that, some lessons learned. Next one. 1, simplify. That's a big lesson that we have learned. So we ended up with a dashboard that had a lot of information because transparency is one of our big values, and we do still think that there should be a lot of transparency in how the model is built and where the information is coming from. But instead, we think that it would be best to have that initial quick snapshot. And then as people are interested and curious, they can drill down through the dashboard to get more of that information. So it's not hidden, but it's also not everything all at once. And I think that would really help adoption moving forward. Also, during rollout, focusing on the functional use of the dashboard by position would be much more beneficial instead of starting with how the model was developed and what precision analytics is all about, because I think that really tuned people out. It's just kind of not part of their world. And so they didn't see where they fit into the conversation when we front loaded the demonstration in that way. And so if I could do it over again, I think a better way to go about it would be to start with, bringing the social workers together first and saying, this is how you can use the dashboard to answer the questions you have. Bringing the supervisors together. This is how you can answer the dashboard for the questions that you have in your role. And then having an additional presentation for the detailed information for those that really like to nerd out in data, but to not kind of overwhelm folks who just aren't interested at that level. Also, no jargon. So the users group is telling us that they're frequently getting tripped up by the term precision analytics. And when it's explained that it's just using past data to see what would help our current youth, they're like, oh, I get it. Why didn't you just say that in the first place? So really making sure that we're not kind of creating these barriers just with the jargon that we're using. So next slide. Some positives. The users group has been a huge benefit. We're a small but mighty group, but they've really provided us with so much helpful information about where to go next. And I also wanted to provide here some of our group agreements that we have for the users group, because I think it's helped make that a really nice, safe space to get that rich feedback that we've been getting. So the first one that was really important for folks was it's okay to ask questions, and especially it's okay to ask the same question over again. We know that this information can get really technical really quickly, and it can take time to digest this information. And so, you might need to come back to the same question over again as you get more nuance to what's going on with the topic. And then also, always a good one, it's okay to not know the answer. And then the next one, information is our friend. We welcome conflicting ideas, concerns, results, perspectives, that whenever we're moving into the space of precision analytics or predictive analytics, there are a lot of ethical questions that come into play, and we want to invite those questions. And we want to invite that conflicting information and conflicting ideas so that we're making sure that the biases that we're bringing in are not being built into the model and baked into the model. And we want to check that as much as we can. Then also similar, be aware of unintended consequences and specifically look for those unintended consequences. Really put that front and center. What could be a negative result of putting this out into our organization? What could happen, and how do we support around making sure that we can prevent that? Also calling out limitations to the model, so that gets back to the value of being really transparent, and also looking for limitations to the model. Again, that same, making sure that we're not baking in our biases. So that's been a huge help in getting such a rich users group going. So next slide. So the next steps that are on the list for us, based on the users group feedback, we are rerunning the model. So we are developing kind of model 3.0 at this point, specifically so that we can get to specific CANS items that we can provide suggestions around, and specific services, not just these roll-ups. And we started with rolling up the services and rolling up to the CANS domains really for statistical power in the model. But we realized that we swung too far towards looking for statistical power, and that came at the cost of usability. So we need to move back towards the usability end so that workers are getting that specificity. So it's not just what they already know. And then, of course, continuing to meet with the users group. And what we're doing right now with them is they're coming to us with their current cases, and we're looking at what the dashboard is suggesting on those cases, and what the workers are saying fits and doesn't fit, and what might just be kind of general information that isn't useful enough, and what would be more helpful for where the case is at and what they're looking for in the dashboard. So that's been really fruitful. And then the next step after we have kind of model 3.0 is going to be a redesign of the dashboard so that it's much less overwhelming, and presenting information in bite-sized chunks that people can drill down through instead of all at once. Next slide. And we're on to questions, and I see one in the chat. Do you have some early trends on what the users are finding with youth versus the dashboard information? Yeah, we do. So what workers are saying is it's really just that trend of, well, I already know they need family finding. Is there more? What more can you tell us? And we do get a little stuck in the conversation of, well, it's based on the information that is being entered into our case management system. So we also have to have this balance around, we don't want workers to be having to select all of these different categories that are part of what they're doing. And yet there's still that request for specificity. So there's some balance around really the raw data that we have to work with. And we don't want there to be this burden of data entry and compared to making the suggestions usable for folks. So hopefully that answered your question a bit, but feel free to ask further if I didn't quite get there.
And Amy, if I may, one of the other areas where we've heard some relatively positive feedback in terms of the usability of the dashboards have also been from our supervisors, who have found that it's a nice, quick snapshot view in terms of their role of, as supervisors to our social workers in individual case-based supervision, and trying to get a quick glance in terms of like, what's the status of this youth and family? What's our service provision look like? And kind of trying to dial in on that question of, is it the right level of services that are being delivered? So I'd say that's been one of the early ones through this as well.
This is Barbara. I hope it's okay to unmute myself.
Yeah. Hey, Barbara.
Pastor, hey. Yeah, so I asked part of the question about the early trends is also what I found when we've had some of our predictive dashboards that a lot of users say, well, yeah, I knew that. And so what I've said to them, well, good, pat yourself on the back. You did a great job. You already knew that. Is there anything new that you're finding? So they sort of dismissed it because so much of it they already saw. But for the 5, 10, or 15% that they didn't see, that they could then tweak what they were doing. I really like how you just brought up with the supervisors and how supervisors can work with the different cases to know what's going on, and then to maybe they'll see sort of a pattern across instead of a one by one. So that I think is a really good use of the dashboard.
Thanks, Barbara. Well, we left a lot of time in the back end of our presentation for any questions. And so I want to call the question to see if there's any questions, comments, reflections, reactions. Please feel free to take yourself off mute.
I'll share. Great to see you all.
See you then.
And cool to see where this has evolved to, but kind of building on what Barbara was saying. In one way too, I think it's a positive thing if the model you're building is matching social workers' lived experience. If what they're seeing looks familiar, that's telling us we're in good ground from a model building standpoint. So I always try to remind them of that, as well as that's great. You're probably a more seasoned clinician as well. So think about somebody who's brand new, who for, your system has seen, 100 of these kids. Your really good clinicians have probably seen a handful of them, but somebody who's brand new, how would they know who it is that's sitting in front of them? And so I think those are always kind of key reminders I pull out when we hear some of those comments.
And I will share one of our great stories from an early adopter, a part of the dashboard that I didn't show. It's for youth that have just come into our care, so before they have a CANS assessment, but it's just there to show the different clusters of youth that have been identified in the model, and then workers are able to select a couple of different options to say where they think the new youth will fit, and get recommendations just right out the gate. And we did have one worker use it for a new youth that they had, and they were very surprised by the recommendations that came up. This youth had a lot of mental health struggles that they would have initially started focusing on, but the dashboard actually steered them towards family finding. And so they did it. They followed the dashboard and went towards family finding and ended up getting the youth connected with their bio dad. And the youth was able to be placed with bio dad and was working out great. And the worker came to us and said, "This is fantastic. It's not the direction I would have gone initially." And they were super thrilled with it. So that's one of our big wins for dashboard rollout thus far, which has been great.
And I would add from some of the more program level reporting and data that I was sharing, one of the benefits has been, how do I want to say this? More informed managing up. How does that sound? So in terms of like our board of trustees, when they're really zeroing in on like what are the overall outcomes of the organization, we can give some advanced prediction around, well, this is what we could reasonably expect in terms of our overall outcomes for this year, given all things considered, and we can highlight the trends and patterns in terms of the youth that we're serving. And that's helpful information for all the obvious reasons as well, just to be able to get a better sense on like, this is what we could reasonably expect in terms of program outcomes over the course of the year or over the course of the next few years. Other questions?
Looks like we have plenty of attendees. You're more than welcome to follow Barbara and Stephen's lead and unmute yourself for any thoughts, questions, concerns. Time is yours.
I'm sorry, maybe I missed this in the beginning. What states are you using this in?
So this is for our out-of-home care program. And we provide out-of-home care services in all of our field offices. And so we have offices in state of Washington, Seattle, small rural town called Yakima, California, where we have offices in the Bay Area, and LA and San Diego, Arizona, where we have offices in Phoenix and Tucson, Idaho, we have an office in Boise, and in Texas, where we have offices in San Antonio and Austin as well. Yeah. And we do all of our work right alongside the public child welfare jurisdiction. So public child welfare jurisdiction is the source of all of our referrals, where we provide side-by-side case management. And in some of our offices, they're licensed child placing agencies, so we provide foster care services as well. Yeah. So, Amy, question in the chat from Yvette. Have you found there to be a shift in looking at other areas of needs outside of mental health to include in providing services since using the dashboard? For example, academics, even if it is not shown as an intermediate need with just using the cans.
Yeah, so I think that understood. Yeah, so I think that has been, we haven't been able to quantify any shift yet in services, but anecdotally, yes, that's been occurring. We do have some background analytics and kind of background dashboards to look at that over time. Similar to what Matt was talking about was, are we beating the odds for what the model predicts youth would go to permanency versus not? We kind of have a similar thing for services, are different services being provided based on what the dashboard is providing. We're still a little early stages to really tease that out quantitatively. But just anecdotally from the users group, we are finding that there's shifts happening.
Amy,
any other questions? Go
Amy,
ahead.
I want to say a couple words about how you use the model for an internal review from a race equity perspective in terms of disaggregating by race and ethnicity the clients we're serving and seeing if there are any patterns related to service utilization there.
Yeah, absolutely. So one of the tenets of the way we built the model was we did not include race and gender in the model as part of the demographics for the youth. And I know that sounds really counterintuitive out the gate. And when I came on board, I had to ask a lot of questions about this because it is so counterintuitive. But the reason that we did not include race and gender in the model is because if we did, we would have ended up with potentially clusters that broke out by race and gender. And if we did that, we wouldn't be able to see if there's different services being provided within a cluster by race and gender. So all that to say, because we did not include it, we did do an internal analysis where we looked at, okay, within each of our clusters, so within each of our different groups of youth, are there certain race, ethnicity, gender, or combinations of race, ethnicity, and gender that are receiving less services that we know work, or a lower percentage of the services that lead to legal permanency, or the flip side, a higher percentage of services that lead to legal permanency. And so we were able to do that within each cluster. So taking account the background characteristics of the youth to see if there's differential outcomes for us. So we basically a large equity analysis. So that was something that we were able to do based on the way that we built our model, and was always an intention in that.
Other questions folks may have?
Even feel free to let the presenters know you enjoyed their talk. I'm sure they'd appreciate it.
All right, well, looks like folks are saying thank you in the chat, and I'm hearing the chime that people are dropping out. So I want to thank everyone for joining. As Amy was certainly highlighting, it has been a journey, and there's more journey that's in front of us. And we're just continuing to learn all along the way. And again, I also think it's great to get a little bit of time back. So we're going to wrap this up just a couple minutes early. And thank you for joining. I hope everyone has a great day. It's been a great conference.